This is SARS-CoV-2. It belongs to the family of coronaviruses named for the crown-like spikes on their surfaces. SARS-CoV-2 can cause COVID-19, a contagious viral infection that attacks primarily your throat and lungs.
This virus is the severe acute respiratory syndrome-related coronavirus 2 that causes the disease called COVID-19 and that everyone simply calls coronavirus. What actually happens when it infects a human, and what should we all do? A virus is really just a hull around genetic material and a few proteins, arguably not even a living thing. It can only make more of itself by entering a living cell. Corona may spread via surfaces, but it's still uncertain how long it can survive on them. Its main way of spreading seems to be droplet infection, when people cough, or if you touch someone who's ill and then your face, say rubbing your eyes or nose. The virus starts its journey here and then hitches a ride as a stowaway deeper into the body. Its destinations are the intestines, the spleen or the lungs, where it can have the most dramatic effect. Even just a few coronaviruses can cause quite a dramatic situation. Since we don't have a vaccine for corona, we have to socially engineer our behavior to act like a social vaccine. This simply means two things: not getting infected and not infecting others. Although it sounds trivial, the very best thing you can do is to wash your hands. Soap is actually a powerful tool. The coronavirus is encased in what is basically a layer of fat. Soap breaks that fat apart and leaves it unable to infect you. It also makes your hands slippery, and with the mechanical motions of washing, viruses are ripped away. To do it properly, wash your hands as if you've just cut up some jalapenos and want to put in your contacts next. The next thing is social distancing, which is not a nice experience, but a nice thing to do. This means no hugging, no handshakes. If you can stay at home to protect those who need to be out for society to function, from doctors to cashiers or police officers. You depend on all of them. They all depend on you to not get sick.
I was sitting in my professor's office hours trying to work on a math problem. A different professor came out and shouted, "That's it, it's over, going home, classes are remote." I think I spent about 10 more minutes trying to solve the problem I was working on before the gravity of the situation started to sink in, and I realized, what am I doing?
The University of Washington became the nation's first large college to close its classrooms, saying it will cancel in-person classes and have students take classes and exams remotely instead.
At Stanford and Harvard, they're canceling classes or they're going to online learning, not just for a couple of weeks, but for the rest of the year.
Around the world, communities are taking drastic measures to curtail the spread of coronavirus. For many colleges and universities, that means canceling events and classes, closing dorms, and dramatically disrupting the lives of students and faculty. In the United States so far, 1,102 colleges and universities have closed their campuses due to coronavirus, choosing to move classes online. Georgetown professor Brian Alexander estimates that college closures have impacted over 14 million students so far. While students, professors, administrators, and public health officials agree that school closures will play an important role in limiting the transmission of coronavirus, this bold move is causing a ripple effect throughout the higher education community.
It all escalated really quickly.
In the last week, it's been really crazy.
It sucks a lot, I think, for people who are seniors.
So as someone who's really not had a lot of experiences online, I was a little frantic. I was a little scared.
Once a new reality set in, students were faced with some logistical challenges. First, there's the issue of housing.
But my roommate is gone. This dorm room definitely feels much emptier without her.
The only undergrads that were allowed to stay on campus were international students, students who have suppressed immune systems, and then other students who are homeless or who don't have a home to go back to.
So they've already said that they're going to prorate our housing, our room and board. I would be very frustrated if they didn't decide to do that.
I'm in an Airbnb right now. Despite the college's offer to pay for Wi-Fi, things are difficult nonetheless. Students can't really go to libraries. You may just not physically have working space.
For students who are housing or food insecure, school closures have exacerbated these issues.
The long-term effects are kind of hard to know, but in general, when you have vulnerable populations, an emergency hits them, it tends to make their life situation worse, just as a sort of general statement. And so I think overall, that's what we're going to see. And the worst thing, I think, is we will potentially could see a lot of students who are right on the tipping point of maybe leaving college, leave and not come back because this was the emergency that tipped them over the edge. And if colleges don't figure out how to support those students well, they might lose them permanently.
When you have 5 days to move out of your living situation, where do you go?
Hi, my name is Hidair and I'm a student from London College of Fashion.
Hey there, this is Kat. I'm a 22 years old student. I study fashion design in Milan in an Academy of Fine Arts. This is my 14th day in quarantine at my parents' house already.
My name is Akir Stewart. I'm an 18-year-old currently attending New York University. All my classes that I'm taking in New York University has just either completely halted or just been changed completely. It has completely changed my life in the span of maybe like 2 weeks.
There's no element of closure. I feel just empty.
My mental health at the beginning was not so good because I suffer from anxiety.
It is affecting everybody I know, but the ways in which it affects me as a young person has just been so extreme, especially as I battle with mental health. Social isolation is probably like my worst nightmare.
Hi everybody, my name is Emily Villaverde. I am a junior here at the University of Miami. Thank you to Multicultural Student Affairs for inviting me to participate in this MSA Real Talk regarding the recent events with COVID-19. Okay, so let's get straight into it. How has this personally impacted me as a student? It hasn't been easy, I'll be honest. Switching to online learning has been a real game changer for me, just because personally I like sitting in a classroom and having the ability to ask my professors questions as we go through the lecture, so that if I don't understand certain concepts, I can ask then and there. A lot of my professors have pre-recorded their lectures, so I haven't been able to ask questions as I'm learning. I would have to write them out through emails. And with lectures over Zoom, it's hard because, you know, I can't turn off my mic and ask my professor a random question. But the professors have been really accommodating. A lot of my professors are having separate meetings for questions and answers, which is really cool. And in regards to lack of materials, so I'm home in New Jersey right now, and a lot of my notes and my materials, which is the same for other students, are still on campus in our dorms and our apartments. But a lot of the professors that I have and in the departments that I'm in have been photocopying textbook pages, adding more notes to lecture slides. They really are being as accommodating as they can with all of their students. And pre-recording lectures actually is really, really helpful for those that, you know, can't make the lecture times because of time differences. So second question, how has COVID-19 impacted your organizations as a student leader? So I am the president for Filipino Student Association, and I am the secretary for Asian American Students Association here at UM. This really threw a wrench in our plans, just because with remote learning, we had to cancel all of our events for the remainder of the year. But thank goodness for technology, we are still able to keep our members engaged and involved in our organizations through Google Hangouts and having general body meetings over Zoom. We really took to social media, and we focused on keeping our members involved by, you know, posting more on Facebook and Instagram, and doing like little activities on the Instagram stories. So I think that's really cool that, you know, we're still able to keep our members engaged and keep our members involved in our organizations and our events, even though we're not physically able to get together. And finally, we're going to be talking about fostering belonging virtually and keeping that positivity up.
In thinking about COVID-19 and all of the events that have been unfolding as a result, I can't help but think about my friends, my coworkers, and my peers who are of a socioeconomic status that doesn't necessarily permit them to get the things that they need in times of crisis, especially not the fastest. For example, I can't help but think about the children who depend on the school system to provide them with free and reduced lunch and breakfast for them to eat twice a day. I can't help but think about my friends who don't have laptops, who depended on the computer labs at school to be able to do their homework. And I can't help but think about the people less fortunate than we are to have a place to go to have a place to stay. I actually have a few friends who come from abusive households, and a lot of that has stemmed from a socioeconomic status that really isn't ideal in situations like this. But then again, those are things that a lot of people my age can't really control. We can't really control where we came from, and unfortunately it's really heartbreaking to me, because during this transition and this time where we're really focused on technology and using technology to our ability, I have friends that have to use their phones to go to class all day. I have friends that don't have laptops, that have smartphones with not the best connectivity of Wi-Fi, and it amazes me that they're able to find ways to be able to attend their classes. But at the same time, it just makes me think, like, you know, what other ways can we support our Miami community? What other ways would be effective in times like this? And really, it's like a no-brainer for technology for certain people, but then there's people that I know that also don't have access to those things. So I'm feeling very fortunate to be able to have this opportunity to attend my classes regularly with my laptop, and to be able to have enough food to eat and enough water, and just being thankful to be alive at a time like this.
Hey everyone, my name is Joy Maguro. I'm the president of the Asian American Student Association at UM, and thank you so much, MSA, for having this Real Talk. And so how this event has impacted us as a student organization is, for us, from the very beginning when we returned to campus for the semester back in January, we were closely monitoring how this virus was spreading and how it was affecting communities both globally and at UM also. And part of this was because Lunar New Year was coming up, and it's one of AASA's biggest traditions every year, which we co-host with CSSA. And there was a lot of talk in place as to the appropriateness of celebrating it, since all of the events in China had to be canceled, but then also the appropriateness of having an event with so many people. But we did take all the public health precautions that are, they're standard for any big event, but we definitely place a greater emphasis on this than we usually do. But then also, and more importantly, I think for us, is that there have been a lot of concerns about, and reports about, racist and discriminatory remarks across the US, both inside of college campuses and outside. So, but one of the things that has been making me hopeful is that there's still, even though this has been declared a pandemic, which probably all of you know by now means that it's global, anyone, no matter your race, your ethnicity, your background, or age, or anything, none of us are invincible against this virus, and we're all susceptible to being sick with it. However, there are still a lot of, and I see in the news and media outlets and people from governmental administration also calling this the China virus, and really focusing on finding a scapegoat and blaming China and Asian communities for the start of this virus and letting it spread, instead of really focusing on our own communities, where we could have done better to keep it from getting to this point, and how we can continue to make it better in the future. But I'm very excited because I think that even though this has been kind of an isolating, and also a lot of us may feel powerless right now, I know I definitely do, just sitting at home, because the best thing we can do is social distancing. The UM community has really been it's really been brought together by this crisis also, as we have in the past with hurricanes and whatnot. So I hope that you all know that AASA is taking full advantage of Zoom. And last week we had our first virtual GBM. It was an online mukbang. This week we're having date auction, and for the rest of the weeks also until the end of the semester, we'll continue to have online events. So please feel free to reach out to us, to our executive board, or any of us if you ever need help, if you want someone to talk to. And also follow us on Engage, like us on Facebook, and follow us on Instagram to stay tuned for our upcoming events. Thank you again, stay safe, and go Canes!